Hello everybody. Today with me Dr. Naresh Bhat is there, and we are going to discuss about some myths and facts about hepatitis in the due course of time, which I think you will find very useful. So it's over to sir.
Well, what exactly do you want to know, Pradeep, on hepatitis?
So
do you think?
yeah, sir. Actually, see, sir, there are a lot of different kind of message normally used to go to the people who are suffering with hepatitis. Different kind of hepatitis we want to know, sir. Actually, in India, what is the prevalence? How the hepatitis spread? What kind of hepatitis are there? So normal information, which is very important for the audience.
See, I think what we need to know is, what does hepatitis mean? Hepatitis means simply inflammation of the liver.
There could obviously be many causes. Some of them are infections like viruses, certain can be drugs, and so on and so forth. But when we really talk about viral hepatitis, we talk about several viruses, and we give them names like virus hepatitis A, B, C, D, and so on. To put it very simply, hepatitis A and E, they are two viruses which are very common in our country, and they are spread through contaminated water and food. And so while they cause some amount of discomfort in terms of vomiting, loss of appetite, may cause jaundice in some people, and maybe children may miss school for a few days. If you're adults, the illness may be a little longer, it may last a few weeks. By and large, the disease is short-lived. But the problem about hepatitis is actually, the more global problem is about hepatitis B and C. Now these are transmitted again by viruses, but these viruses reach you through body fluids, blood, and in India and in a lot of parts of the east of the world, that's China and Taiwan and so on, it's actually transmitted from the mother to the baby. The problem with these diseases are that they tend to be long-lasting. What we mean by chronic. Chronic means the disease is long-lasting. And when it lasts for a long time, these diseases can cause progressive liver damage, which can lead to cirrhosis, liver failure, and also liver cancer. So while hepatitis A and E are important, but I think the bigger problem is hepatitis B and C.
So you mean to say hepatitis A is not a life-threatening disease like hepatitis B or C?
Well, in a way you could say that, but it does take lives, but maybe a very small number. If you have 100 people infected with hepatitis A, we may lose 1 out of the 100, right? So that's again a small number. So it is important, and hence there is a vaccine available for hepatitis A, which I strongly advocate at least in two groups of people. One is people who travel, people who are traveling frequently, especially young kids who are traveling, young kids who are going to stay in hostels, or maybe software engineers who are going to stay in a new place, eat out. Certainly I would recommend hepatitis A vaccine for them. The other group is patients who already have a liver disease because of something else. Say if you have hepatitis B or some other kind of hepatitis or any other viral illness or liver disease, I would protect them against hepatitis A because I don't want a second illness to occur. Unfortunately, we don't yet have a vaccine for hepatitis E, so there you just need to protect yourself by making sure that your food that you eat is clean, the water is clean. Boiled, cool water would really be the ideal thing.
So same suggestion for hepatitis A also?
Absolutely, absolutely protect. But in addition, we have a vaccine, and that makes it a valuable addition.
So sir, we want to know little more about hepatitis B and C. As you told, it's a little more complicated disease and it's a burden now in...
True. Now, as I said, the burden is because we have, if you imagine, if a baby gets hepatitis B from its mother, that's transmitted from the mother, the chances are 90% of the time that the illness will become chronic. That means the virus stays on the body, and over a period of time, which may mean several years or maybe even a couple of decades, it may cause severe liver disease. On the other hand, if an adult gets the same virus, say a 30-year-old or 40-year-old, whose immune system or the body's resistance is good enough to fight the virus, the chances that it will stay on may be only 10%. So while 10% get better when you're babies and 90% continue to be affected, it's the reverse in adults. So that is why it's very important to prevent young babies from getting infected with the virus. And that is why pregnant women are screened for the virus, and sometimes if they are positive, we put them on some medicines to bring down the levels of the virus so that transmission to the baby is minimized. The second strategy, perhaps strategy that's far more widely used, is the practice of immunizing these babies at birth. So one of the earliest vaccines that they get is a hepatitis B vaccine with the first dose. The second dose comes a month later, and the third dose, of course, 6 months later. So that has been incorporated in the immunization program. So that helps us, hopefully, in the next 20 years, we will see far less people afflicted with hepatitis B in the world than what we have now. In fact, there's a really wonderful study that was done in Taiwan that they showed when they immunized children and babies with hepatitis B, not only will they be able to bring down the rates of liver disease, but the rates of liver cell cancer dropped dramatically. I think you could see that effect within 10 to 15 years. So I think there's a lot of hope with the hepatitis B vaccine.
Okay, sir. Sir, just one thing I just want to know from you. Suppose after even giving the treatment to the mother, is there any chance that baby after that also can get hepatitis B virus?
Yes.
And then what
Okay.
to do?
Okay. Let's put it very simply. If you have 100 mothers who are hepatitis B positive, and we use both the strategies, screening, treating them if they have the high viral levels, and also immunizing the baby, we find that we can cut down the transmission by almost 98%. So you may have 1 to 2% of babies still getting the infection. So very small. Now for them, what we tend to do is we watch, and then if they are positive, we can think of antiviral therapy. See, this is a myth that is prevalent widely amongst the general population, that there are no drugs for hepatitis or viral disease. I think nothing can be further than that. The truth is very, very different. Actually, for hepatitis B alone, we have at least 6 to 7 medicines, which are excellent drugs. For hepatitis C, again, we have at least 3 drugs available to us in India, and I believe at least 8 more drugs that are in the pipeline that will be available within a year. So there are a lot of drugs, and so the challenge is to select out those people who will benefit from the treatment, who actually need the treatment, and then ensure that they have the right drugs and they take it for the complete course. I think that is the challenge. The challenge is no longer is there a drug or not, is selecting the patients and making sure they take the medicine.
True, sir, true. And like you mentioned just now that there are some myth or stigma is there. So any information or any message you want to give on that about social stigma on hepatitis B or C?
Yeah, the stigma is largely because of the misconcepts that it can't be treated. I have a lot of patients doctors in fact, funnily doctors who sit quietly on their hepatitis infection. I had a famous doctor of Bangalore. We lost him because he just did not take treatment, believing that either the treatment was not there or may not help him, or it's got a lot of side effects. And we lost him 4 or 5 years down the line. You see, these are preventable. So similarly, we have a lot of people who are misinformed that there is no cure, so they try some things which are really not worth it. While in today's world, I think there's excellent drugs available. Not just today, we're talking for the last 10, 20 years. Very good drugs are available. The other myth that we have is that, oh, I don't take injections, I've never taken blood, I've never been to a doctor, and so on and so forth, so I can't be having hepatitis B. This really is not true, because as I said, the major transmission occurs around birth, at birth or in the early phase of the newborn, that is from the mother. And this everyone forgets, and it is not very apparent. So a lot of people actually reach adulthood having picked up the infection as babies, and they are not aware. And so they go and take a vaccine, and then they blame the vaccine, saying the vaccine has not worked. While the truth is that the infection has been picked up many, many years earlier. So I would believe that if you are vaccinating adults, or if your adults who are taking the vaccine, first get tested for the hepatitis B. See if you actually have the virus already, and then take. Unlike babies where, this is not really needed.
It's mandatory. For babies, it's mandatory.
We give the vaccine straight away. We don't have to do a test and vaccinate. While adults, we'd like to test and then vaccinate.
Okay.
The other thing that I also thought I should talk about is hepatitis C. Now, hepatitis C is very similar to hepatitis B in terms that it is chronic, goes on for several years, can cause liver disease, liver failure, cirrhosis, liver cancer over several decades. Again, good medicines available. But what I think is important is to realize that a lot of transmission occurs because of blood transfusions or blood products that have not been tested, or even if they have tested, we have a small number that can get missed on this testing. It may be a small number, maybe less than 5%, but nonetheless it's there. But I think the big threat comes from IV drug abusers, people who take intravenous drugs like heroin and things like that, and they get, and they also tend to transmit because the same syringe is used by other people. So I think for the layman in the community, I think make sure that if someone says you need a blood transfusion, maybe it's a good to ask him twice whether it's really needed. I really see no reason why someone should have one bottle of blood. It doesn't make any sense at all. If you really need blood, you need more than one bottle. One is not going to save someone's life. The second thing is that a lot of times we give blood when it's not needed. Someone's hemoglobin is 10, 11, or if someone says, oh, I'm feeling weak, let me go and take a bottle of blood. I think those things need to be avoided because you never know which of those blood products is transmitting the disease. So to minimize the risk, I think that would be a good thing to do.
So unlike hepatitis B, Hep C is more, this transmission route is more through blood products rather than mother to baby.
Mother to baby is small. Mother to baby or sexual transmission is much smaller in Hep C. Is much smaller in Hep C.
So what is the burden of hepatitis C, sir, in India?
Oh, that's very interesting. See, world over we talk of about a figure of about 1% of Hep C, whether it's in the United States or in India. But funnily enough, in India, at least in parts of India, and my colleagues in Punjab and in the Northeast, of course, very well known with the high number of drug abusers there, IV drug abusers, this number has actually gone up tremendously. So in some areas, there are 3 to 4% of thing, which is very large. I mean, if you're talking about hepatitis B, we used to talk about 5% for India, and we now say realistically it's about 3%. But except for in Northeast, again, it's up to about 8%. So Hep C is unfortunately almost caught up with Hep B, at least in some areas. And the reasons are very obvious. It's because of the widespread drug abuse, perhaps in these areas.
So I think, sir, awareness is also take a very important role in this. And now on the World Hepatitis Day, eve of World Hepatitis Day, just a gist message you want to...
No, just, you're right. See, awareness is important. Awareness is important to the point that we need to try and prevent any disease as much as possible by, lifestyle measures, good hygiene to prevent these waterborne diseases, vaccination. But Also, apart from awareness, you need to be clear that if there is a problem, excellent drugs are available to treat. I think that's the most important message that I'd like to give, is while you must make all attempts to prevent, in the unfortunate circumstance that we are not able to prevent it, treatment is available, treatment can be taken, and we are close to a cure. Certainly in hepatitis C, to a large extent we can make a huge difference in hepatitis B. We can prevent progression, we can actually reverse some of the changes, and we can prevent a lot of complications in hepatitis B.
So sir, thank you so much for taking your time out and give these messages to the public. And I think those people who is going to watch this video, they will gain a lot of information from you, and it will be very helpful to them, and I think they will also going to spread this message to many others.
Yeah, thank you Pradeep. Thank you so much.